Do you hear that? That ringing in the ears? Well, that's not normal, so we've got Dr. Jennifer Derebery from the House Clinic in Los Angeles. You're an ear, nose, and throat doctor.
Correct.
So many people have that ringing in the ear. Is it normal?
It's not normal.
Okay.
We call it tinnitus, and it means there's a sound you hear in the absence of outside sound coming in to stimulate it. And a lot of things can cause it.
What are some of those things?
Most people with tinnitus have hearing loss. And the theory is that when the brain is expecting to hear sound and it doesn't, it'll fill in the blank. It'll actually generate its own noise at the brain, kind of like a localized seizure, and make sound.
Interesting. I never knew that's what was happening.
Okay. I have that.
Oh, no,
I don't want to say it, but I have that. And also, sometimes I hear like the ocean, you know, like the seashell.
And you're just like, oh, this is lovely.
So what should I be doing? How can I take care of this now, since I'm admitting it openly? I have it.
Well, here's my business card. Now, the first thing you need to do seriously is get a hearing test.
Okay.
And see, is there a hearing loss that's causing it? And I'll assure you, most of the time, there's not some life-threatening, horrible problem causing tinnitus. If there's hearing loss and we can address the hearing loss, a lot of times the tinnitus will get better. Sometimes it's medication or drinking too much coffee, stress, things like that you really can change.
Really,
So
things like diet.
Diet absolutely plays a big role.
You don't even think about diet associating with your ear.
Absolutely,
No,
not at all.
Too much aspirin, too much caffeine, guaranteed to make your ears ring.
Oh, wow. Never knew there was a connection. What about dizziness caused by inner ear issues? What causes that?
Well, to have normal balance, the brain is the center of balance, and you've got input from the inner ear, the eyes, and the feet and spinal cord. So it can be the inner ear, and typically with inner ear, we want to ask them, what do you mean by dizziness? Do you feel like you're drunk or what? Typically with inner ear, there's going to be some sense of rotation. Either you're moving or the environment's moving, something like that.
Now, with that, as we were talking about that, I clean my ear with a Q-tip. So for this preventive maintenance, is that correct? Because I didn't want to believe it, but how should we clean our ears and how should we maintain our ears so we don't get to this point?
I'm going to get so much business from you. You do not need to clean your ears. It is normal. It is good to have wax in the ear. Wax kills bacteria.
A lot of wax.
But yeah,
It's uncommon to get so much wax that you can't hear.
Oh, I don't get that. No, it's not me. Someone else. That's
You're shoving it in deeper with a Q-tip.
Yeah.
And if it gets in too deep, the ear can't clean itself out, and then you have to mechanically get it cleaned out.
And you can also damage the eardrum as
Yeah.
well.
Yeah, I can't tell you the number of eardrums I've seen ruptured because of Q-tips.
Oh my
Just
gosh.
leave it alone, and if you're one of those unusual people that really needs to get your ears cleaned, then a doctor can do that for you.
So
What
stick to
about-
the Q-tips with the makeup.
You know, they have all these products, ear candling, ear water, ear soap. Do they work?
I don't know about most of them, not ear candling. And in
Okay.
fact, the FDA is going to take it off the market if they haven't already, because there have been so many injuries related to it.
Wow.
And the others, they're on TV, and you know, I don't comment about it if I don't know how bad or good they are. I don't really know.
What injury would come with ear candling? Because a lot of people put the wax in, and that wax, they think it's their ear wax.
Yeah, it's not. It's the burned wick from the candle that's the dark stuff coming out.
Are you serious?
No.
So it makes their product look like it's working.
It makes it look like it's working, and it burns the eardrum.
That's
the wax will
really
go in
scary.
deep, burn the eardrum, and it
That's
can burn
serious,
and
yeah.
rupture the eardrum and go in and actually damage the inner ear.
And painful.
What are some other preventable things that we are probably doing and shouldn't be?
The simplest thing for wax is just put some baby oil in the ear once a month or something to soften it, and then diet. So much of hearing loss is related to diet. High cholesterol, lack of exercise, things like that. Again, those are, you think about cholesterol with other blood vessels in the body, it affects the blood vessel to the ear too.
You just
That
never think.
it makes sense when you think about it, but you don't think about it.
Healthy diet,
it does.
healthy ears. You don't put it together.
Yeah.
Wow.
All right, well, thank you so much. These are great tips that you've given and some really important information, because we really don't take care of our ears enough. So take those Q-tips away, throw them away, but we'll be back with more Every Way Woman.